So friends, today we are going to talk about some of the surgical instruments that are used during the procedures in anorectal surgeries. The first one is the swab holder, or it is also known as the sponge holding forceps. The sponge holding forceps, it has long shafts. As you can see in the image that it has long shafts. The blades are round and are fenestrated. We can see the fenestrations in the blade and they are with serrations on the inner sides. The catches are provided on the handles. The instrument is long to keep the surgeon's hands away from the operating field while cleaning and painting antiseptic solution on the operating field. The next one is the towel clip. The towel clip, it is used in draping to hold the sterile towels in the place. The next one is the artery forceps. The artery forceps, it has ratchet handles and transverse serrations on the inside of the blade. We can see the transverse serrations inside the blade and ratchet handles. Typically, blades are half the length of the shaft. These blades, they are half the length of the shaft. Straight or curved artery forceps are named after their blades, which can be straight or curved respectively. Hilton's method involves the use of artery forceps to open abscess. They are also known as hemostatic forceps. They may be short, medium or long according to their length. The next one is Mayo scissors. The Mayo scissors, these are used for sharp dissections and suture material cutting. They can be curved or straight with sharp or blunt points. The straight scissors, they are used to cut suture materials as well as the superficial tissues, while the curved scissors are mostly used for sharp dissection in deeper tissues. The next one is the dissecting forceps with teeth. We can see the teeth in the forceps. It is primarily used to support structures such as skin, fascia, aponeurosis, muscles, tendons and so on. It is mostly used in anorectal cases to trim the skin margins after fistulotomy or fistulectomy. The next one is the Ellis tissue forceps. The Ellis tissue forceps, the blades are longer and there is a gap between them. So we can see that there is a gap between them to allow for some tissue to be accommodated between them. The sharp teeth with grooves are provided at the tip of the blades. When the instrument is closed, the teeth of one blade fits into the grooves of the other and vice versa. The Ellis tissue forceps, it is used in anorectal surgery to hold the fistulous tract during core fistulectomy as well as to hold the external hemorrhoidal mass during pile suturing technique or hemorrhoidectomy. The next one is the Babcock's tissue forceps. The Babcock's tissue forceps, the blades are fenestrated. We can see the fenestrations in the blade. They are curved and have no teeth at the tips. Instead, they have transverse serrations in their tip. It is used in pile suturing technique to hold the internal hemorrhoids in place while the suture is being applied. The next one is the Lahey's forceps or the right-angled forceps. It is known as right-angled forceps because the blades are curved at right angle to the shaft of the instrument. We can see the shaft of the instrument and the blade of the instrument. They are at right angle with each other. So, in anorectal surgeries during MIKST, minimal invasive Charge Sutra technique, it is used to locate the metallic probe at the self-created window. Here in this image, we can see the self-created window during MIKST. So, in between the external opening and the internal opening, there is a probe inserted and a self creation of a window is done here, and in the window we can locate the metallic probe with the help of right angled forceps. The next one is the needle holder. The needle holder, it is used to hold the needle while suturing. It has short and broader blades. It has short blades and relatively broader with criss-cross serrations. We can see the criss-cross serrations in the blades. There remains a groove. We can see the groove here in the blade. There remains a groove in the inner aspect of the blade in addition to the serrations, which help in the fixation of the needles. During pile suturing technique and hemorrhoidectomy, it is used to hold needle during transfixation of the pile smash. It is used to hold the needle during closing of the wound during lateral internal sphincterotomy surgery in fissure in ano. The next one is the probe. There are multiple types of probe as we can see in the image. Images here. Probe, it is a malleable instrument with a blunt one end and an eye on the other end. It is used to detect depth and direction of sinus or fistula. It is used to detect any foreign body inside the sinus. In fistula in ano, it is used to push it through the tract and then incise the skin to lay open the fistula tract. At this image we can see the insertion of probe along the length of the fistula tract. It is also used for core fistulectomy. In this picture we can see the fistula tract which was excised from the fistula during core fistulectomy. So the next one is the sinus forceps. The sinus forceps, it is a straight instrument without any catch on the handle. So we cannot see any catch on the handle. It has long and narrow blades with transverse serrations on the inner aspect near the tips. So we can see the serrations only near the tips. The whole blades are not provided with the transverse serrations. It is used to explore and drain the sinus. After the incision of the abscess, it can be used for proper drainage. It is used to take any foreign body out of the sinus. It is used to pack gauze into the deep wounds. So the next one is Sims speculum. The Sims speculum, it is used to visualize the anal canal during inspection. It is used during hemorrhoidectomy to visualize the pile marsh, as we can see here in the image. It can be used in retrograde probing of the fistula tract to visualize the internal opening at the anal canal. So the next one is the anal speculum. It is used for examining the interior of the rectum and anal canal. After removing the obturator, so this is the obturator, after inserting the anal speculum in the anal canal and rectum and removing the obturator, we can see the interior of the rectum, and it can be either plain or with window. So here we can see a normal anal speculum and anal speculum with window. The speculum with window is also used in applying char during char karma in hemorrhoids treatment. So we can see in this image, we can use the anal speculum with window to apply the char during the char karma. The next one is the Mezenbaum scissors. The Mezenbaum scissors, it is a long and fine scissor. It is used for dissection at the depth. It is used during core fistulectomy or fistulectomy. So the next one is the Bard-Parker's handle or the BP handle. The BP handle, it is a flat stainless steel instrument with one end narrower with a slot on either side for attaching scalpel blade. It is available with different numbers of 3, 4, 5 and 7. It is used to fix the scalpel blade. So here we fix the scalpel blade during fistulotomy or LIS. So these are some of the instruments that we talked about the anorectal surgeries today. Thank you.